Welcome. A little bit of background. I'm a human doctor. I got involved I was raised with silver animals and had many rescue dogs over my life. Have 4 right now. And early in my human dental career, I was asked by local veterinarians to come in and help assist them with oral extractions and teeth cleaning and so forth. And I sort of got knocked right into pet care, even though my career wasn't in that direction. So, in addition to that, for the last 7 years, have hosted a cable TV show called Let's Talk Healthy Pets, and now I'm doing a show called Healthy Pet, Healthy Owners. And we modified the show because there's not really a great difference between us and our animals. There's some minor differences, but they have 2 eyes, a nose, kidneys, liver, teeth, the same as us. And they require a lot of the same nutrients that we do. So I'm not going to make clinicians out of anybody, but I want you to have a little bit of background so when you have clients that come into your place of business and they're having concerns about the oral condition, and there's always that fear factor, and they don't want to go to a veterinarian sometimes. They come to see you guys first. Just wanted to briefly give you some of the symptoms that clients may present to you in things that they're seeing on their animals. So they'll complain of offensive breath or buildup of junk on their teeth. We call it biofilm when it's a soft, plaquey type material. When we call it tartar and calculus when it becomes very hard. A lot of times the animals will refuse to eat and drink, and that's always could be an indicator of a lot of things, but it could be a great indicator of how their teeth are hurting them and they're having problems eating. If they rub their face, if there are chronic ear infections, you can most often generate that back to its origin being the gums. A lot of times they'll come in and say, well, there's bleeding, my dog is salivating more than normally, or there's some type of pussy discharge. Again, we can look at infected gums. They'll see swollen gums, red gums. We call the gums gingiva professionally, and that's not normal. Nor is an animal to be either very lethargic and lazy and not want to do anything but sleep, or a dog that becomes very agitated. That can very, very easily become a sign of gum issue. I do want to tell you that this is available on the Horn website, so the whole slide deck will be there for you to access. And I do believe Luke here is taking it, and that's going to be presented as well, so you can review it at any time. Again, we have thousands of bacteria in our mouth on a daily basis. Some of them help us digest food, some of them are pathogenic and cause a problem for our health. It's not important to know how many we have. What's important to know is about a quarter of them are the same in your dog and cat's mouth as in our mouth. So that tells you a couple things. That tells you that the same way that we approach our oral hygiene, we can approach a dog's oral hygiene and the cat's oral hygiene. The other thing that tells you is we're sharing. And so your dog can share some of its bacteria with you, and you can share some of that bacteria with them. Again, that's just an example of 4 of the most common bacteria that's in our plaque, that biofilm that I spoke of, that we share between the dogs and ourselves. What I find most interesting is these 2, and it's not important really to know the names of these, no one's going to ask you that, but the dogs don't naturally have those 2. They only have them when we have them, and we give them and share them to the dog. Again, some of the bacteria that are common to both animals and humans. What I have this screen up here for, catalase is let's say an igniter of the growth of the bacteria, of the metabolism of the bacteria. And so we think they all act the same, but in fact, when it's with an animal, that bacteria can adapt because the animals are catalytic positive, where we are catalase negative. Catalase is an enzyme, so that bacteria is able to use our own systems to populate itself and to grow. So it doesn't take long to develop in our mouths and create an issue. You know, I always heard this growing up, that dogs had cleaner mouths than humans, and that dogs are more acidic than we are. The fact is, dogs are more alkaline than we are. What alkalinity and acidity are, it's basically oxygenation. So a dog actually holds more oxygen in their cells, in their mouths and their stomach than we do. It's the pH, or potential hydrogen. So as a result, there is a slight difference in how you attack the buildup in their mouth, and as well as the organisms that pass into the stomach and the intestinal tract from us. This potential hydrogen is controlled by the thyroid of us and the thyroid of our animals. So a lot of dogs you'll have clients that come in and will say, no matter what I do for my dog, that I'm having the problem with the teeth. I brush their teeth, I use this, I do that, they get their teeth cleaned every year or whatever. You can look to the thyroid and may even suggest to your clients, well, if you're having that type of problem, have the doctor, the veterinarian, diagnose the thyroid properly. Because the thyroid controls all of that pH, and that pH with the alkalinity in our mouths and our stomach is, again, all controlled from that. And it determines what the bacteria is in the mouth and how it will grow. And that'll hold pretty much true to every systemic disease that your animal has. Yes.
So the thyroid controls the pH in the entire body?
It controls the alkalinity and the acidity of every cell in your body. Every organ in your body, your saliva, your urine, everything. So if this is not functioning properly, and I will tell you within humans and animals, this is the most misunderstood, undiagnosed, misdiagnosed organ that we have in our body. And if you sit there and you think, okay, I'm giving my dog water, and you're using tap water, and you're giving fluoridated water, that fluoride in the water displaces the iodine that the thyroid needs to function, and you have a non-functioning hormone circulating in your body. So as a retailer, and you're in your small shop where you have a one-on-one with your client, and you can talk with them, you of course can't tell them what to do, but you might be able to just bring that to attention and say, you might want to have the doctor look at your thyroid. My understanding is this could be a thyroid issue as well. So hard food, soft food, I always, no, come on, sit down, bro.
I can't hear you.
I always heard this, hard food keeps your teeth cleaner. Soft food is worse. It causes tooth decay and gum disease. The fact is, that's not true. Our dogs don't have grinding surfaces on their teeth. They have points. Their teeth are all pointed. They're meant to chew. So hard food may, if there was anything stuck to the tip of the tooth, as they crunch down, it may clean that tip a little bit, but it's doing nothing for the facial surfaces or where the gums are, because the tooth isn't designed to self-clean that way. So soft food is a little bit stickier, but it's also moist. And when it stimulates the saliva, that will actually help wash away. So if I had the choice between feeding hard food and soft food, I would go with soft food. But what's even better is raw food. Because raw food has enzymes in it. And those enzymes naturally clean the surface of the teeth. You certainly wouldn't want to tell someone to switch to raw food, because there's a protocol to follow to introduce new bacteria to the system that your animal isn't used to. Same thing with you. If you suddenly go to a completely raw diet, you're going to have some variations, you have tummy upset and so forth, digestive issues. But I would have my dog on a raw, and in fact I do, on a raw food diet. Yes?
Does that include the
I would say it does. Absolutely. Yeah. Because they haven't destroyed the enzymes that are in the food. Freezing doesn't do it, heat does it. So yes. Some of those foods though, people tend to warm up with warm water and they make the water too hot. That will diminish the digestive enzymes. So it's warm water that you dissolve in it. The question is, how do you prevent pathogens? Pathogens we all have pathogens in us. In fact, all bacteria are really pathogens. It's the abundance of the pathogens that create the problem. When your system's out of balance, or you have too much of one bad, I hate to use that word bad bacteria, but if you have a large amount of one bad bacteria and it overwhelms all the other fighting bacteria that keep everything in check, you get sick. Right? So the answer to that, I would say, is know the food that you're buying. Know where it's sourced, know how it's made. Know what you're feeding your animal. I hope that answers the question. Everything that we consume becomes a fermentable sugar in the mouth. Everything that's consumed and becomes that fermentable sugar becomes an acid. Acid helps do the damage. So, would I want to give my dog a grain-based diet? Absolutely not. Do I want to give my cat a grain-based diet? Never. You know, you could fudge a little bit on a dog because a dog in the wild will eat a stomach. A cat will never eat a stomach in the wild. So, dogs are used to eating greens, grasses, not necessarily grains. So grains are nothing more than carbohydrate. Plus, no dog has, or no human for that matter, has an enzyme to digest grains. So keep that in mind when if somebody's coming into the store and saying, "What's a good food for my dog?" or "What's a good food for my cat?" Yes.
Are other kinds of foods, like a lot of manufacturers post about like barley or oats instead of
The question was, are oats and barley the same as corn and wheat grain? No, there is a difference. Gluten is a problem with grains, and corn even has its own particular gluten. You know, you think about it, you can't digest corn. You see it when you eat it, corn on the cob, you know, after it goes through your digestive tract. Your dog can't do that either. So there is a difference, but I would keep that to the minimum. They're all carbohydrates. And while your animal needs a little bit of carbohydrates, it doesn't need a grain, oat, barley-based diet, in my opinion. Any other questions on this? You know, what I'm doing is briefly going over everything and just touching on things and hoping that generates a question or prompts you to investigate it a little deeper. So dogs and cats have tearing teeth. We have all different types of teeth. We have grinding teeth, we have tearing teeth, we have chewing teeth. They do not. I will hear veterinarians tell me that dogs chew their food, and I will tell you it's totally impossible for a dog to chew its food. A dog is a hinged mouth, and it only does this. This is not chewing. You try it sometimes. Try to eat something and just chomp on your food like that. You can't do it. You can't chew your food. What we do as humans is we translate. So we do this, but at the time we're opening and closing like this, we're sliding. So we're sliding this way, we're sliding this way, and we are chewing our food. What that does for us is it helps to break down that food with digestive enzymes, and our teeth are designed to naturally clean themselves. And that process of chewing helps that along, and we develop saliva, what makes it moist and less sticky, and we swallow it. Dogs and cats don't have that option because they're just doing this. So, as far as I'm concerned, the type of food you feed your animal just on the basis of oral health care is paramount here. When you feed something that's an animal's not meant to have really, they wouldn't eat it naturally, you then start a process of slowing down digestion, changing that pH, and creating these pathogens to wake up. I will tell you this, most pathogens, if not all of them, become alive, become aggressive in an acidic, non-oxygenated, high pH, you can say high pH goes to the positive side, high pH environment. So anything that we do as caretakers for our animals that accelerates that going to the acid side creates a pathogenic state in the mouth and in the stomach and in the intestines, and in every cell of the body. So this biofilm that I was talking about is a bunch of bacteria, millions and millions of bacteria. It's soft. You can take your fingernail and wipe it away. You can take a toothbrush and wipe it away. In about 14 days, that becomes hard because it becomes calcified. And it's the bacteria's way, it's a body defense mechanism, first of all, and it's a bacteria's way of protecting itself. You can't brush it off. You can sit there and you'll brush the tooth enamel away before you ever brush the plaque away. That's how hard it is. I'm sorry, I said plaque, I meant to say tartar and calculus. They're synonymous, tartar and the word calculus. So when you see that hard buildup on your animal's teeth or on your own teeth, if somebody complains and says, I see the stuff on my dog's teeth and I can't get them off, especially the canines and the molars, that's calculus. And you really need a professional cleaning to do that most of the time, to remove it. So that tartar that I was talking about forms in 10 days of not removing that soft biofilm that we call plaque. It also stains, but you'll see staining on your animal's teeth or your own teeth. That's not pathogenic. Food stains, coffee, tea stains, it's a natural thing. That's not harmful. Dental caries, or we call tooth decay, that's only about 5% of animals have an issue like that. And it's usually not caused by the food. It's usually because the dogs are eating ice cream and other high sugar junk. The problem is this gingivitis and periodontitis, or gum disease. Gingivitis is the initial inflammation, slight swelling, a little bit of redness. When you've gone to periodontal disease, you have bleeding, you have tooth loss, you have pain, you have basically suffering in the animal. Yes? You can have some blood with gingivitis on a hard impact. With periodontitis, you could go like this to their gums and they'll bleed. Or you'll see a wiggly tooth. When you see a wiggly tooth, or somebody complains to you about a wiggly tooth, that is, they're in a stage of severe gum disease. So what's interesting is, the blood vessels in our gums are right at the surface, which means that everything we put in our mouths, or everything we put in our dog's mouths, gets absorbed in the bloodstream immediately. Think about it. Somebody has a heart problem, they take nitroglycerin, put it under the tongue, it's absorbed right away, instantaneously. Well, the same thing happens with bacteria. So this professional cleaning is important. The problem with it is most professional cleanings require general anesthesia, and general anesthesia can be an issue. It can be life-threatening. And it's something not to take easily and just saying, here's my dog, go do a cleaning. I personally had a dog that developed seizures a few weeks after having a prophy, tooth cleaning under general anesthesia, and was dead within 2 months. We couldn't control the seizures, even though I took the dog to Ohio State, and he spent a week in the hospital, and they were trying to do everything possible. The anesthesia triggered something in my dog that caused a seizure. I had a second dog that did the same thing. I had her for 10 years, and her seizures progressively got worse. It's fine up until the point of general anesthesia. Over the years of me doing teeth cleanings for animals and having my pet show, I get 3 to 4 cases a year where I'll get an email from somebody and say, my dog had general anesthesia and either died or had seizures afterwards. So that's not something that we take lightly, just handing the dog over.
What's your opinion of the non-anesthesia dental treatments?
I think it's a great alternative if you find someone that knows what they're doing. If your dog cooperates, I've tried that on my dogs. They don't cooperate whatsoever, even if I'm doing it. Also, they won't do that if it's a progressive case of gingivitis or periodontitis. That's an annual cleaning type thing, or every 6 months when there's just a very minor buildup. Which, if your animal's in that state where it's just minor, a great way to do it. But you have to have all those factors into it. It takes a little more of your time because it might be a few visits and so forth. But if I could personally with my dogs be doing that, I'd be doing that. You know, I've held them with my hygienist, cleaning them. It's like torture for them and us as well. So to have their teeth cleaned, it would be general anesthesia. But there are some alternatives I'm going to talk about. So this professional prophylactic or teeth cleaning is a mechanical debridement. We actually get in there and clean that. And you can do that even at home, or your clients can be instructed to do it at home, just a piece of gauze and water. That's mechanical debridement. You take a piece of gauze, you wet it even with water, and just wipe the tissue and the gums the way the teeth grow. Diet, I alluded to that a bit earlier. That is so important to feed species-specific food to help, even besides the systemic burden, help the oral cavity stay well. You know, we neglect water. Water rinses, it washes, it hydrates, your cells function better, helps keep that pH up, but I would suggest making sure that the water the animal is being fed is free of chlorine and fluoride. Chlorine, fluoride, and fluoride. Yeah. Chlorine and fluoride, especially fluoride, are extremely toxic. You'll hear it in dentistry all the time. Makes for strong teeth involved. Prevents cavities. Well, I can tell you fluoride does prevent cavities. It's so toxic that it kills anything on contact. And over the long term, kills and does harm to us as well. It actually displaces iodine from your thyroid, and your thyroid requires iodine to function. So, on my hazard list would be fluoride, especially. Yes. She was asking if I said displaces iodine from the thyroid, and that's correct. Our thyroid functions with iodine. Iodine, fluoride, chlorine, bromine are all halides. Those last three that I mentioned are halides, small molecules. They have a greater affinity to be picked up by the thyroid. The iodine molecule is larger, and it actually gets displaced and can't re-enter once there's fluoride, chlorine, and bromine in your thyroid gland. So we've heard you talk about teeth 1 through 4, and I'm going to go into more detail this on tomorrow's lecture. But we talk about 1, 2, 3, 4. Those number 4s are iodine molecules with tyrosine. So we spoke about diet-specific food and this water. Two important things to consider when you're feeding your animals. So I would say human toothpaste. Never. Human toothpaste is so toxic, and if you ever look at the list and then you go down to the bottom list, it says, do not swallow. How do you not swallow the toothpaste if you just brush your teeth? It's impossible not to swallow it. Yet those ingredients in there, those chemicals in there are extraordinarily toxic. And you think about it, you're absorbing those toxins directly into your gums, into your bloodstream, and you're doing it daily, twice a day, 3 times a day, over years. Now, you know, we're sizable. We have large kidneys, large liver. Most dogs have a tiny liver and tiny kidneys, and they cannot filter those toxins out of their bodies like we can. Plus, we sweat to get rid of those toxins. They don't. So, never use fluoride. I mean, the human toothpaste. I talked about the fluoride. These other ones, the sulfate and the phosphate. If you ever look on your soap that you wash your clothes in, you'll see those same ingredients in the soap that you're washing your clothes with. Do I want to eat those? Do I want to put those in my mouth? Do I want them in my dog's mouth or my cat's mouth? No, I don't. So, you know, a toothbrush works. I would always suggest a soft toothbrush. You could sell them in your stores. Baby toothbrush, especially for smaller dogs, infant toothbrush. But you don't want to press hard. And the reason is, you know, I keep alluding to this gum absorption of the blood vessels and bacteria. When you're brushing hard, you're injecting, just like with a syringe, that bacteria right into the gum line. So you can advise your clients, yeah, we sell soft bristle toothbrushes, but you want to gently brush the teeth. You don't want to press. You know, in dentistry, I was taught, you know, brush fairly fairly vigorously for length of time, 3 minutes per this, whatever. Nah, it's a daily debridement soft brush. Gauze does the same thing, wiping the teeth down with gauze. Soft chew toys work. A chew rope, I love chew ropes. It does a lot of things for dogs, but I wouldn't want a chew rope that has colorful dyes in it that are toxic to my animal. A raw, natural chew rope works perfectly. Of course, you either want to wash it or throw it out because that's going to harbor bacteria over time, so it's not something that you buy once a year. Carrots, oddly enough, my dogs like them, they chew them, they clean the teeth. They're punching down, they're forcing that down. So, raw chicken wings and necks have the digestive enzymes and do a great job of keeping the oral cavity clean. You wouldn't want to cook them, you want them in small pieces, and just that little bit of the closing that they open and do when they first tear can help clean that the teeth. Frozen bones are good. Of course, we're looking at quality stuff here. Chew sticks, I'm a little iffy on because there's issues with chew sticks. A lot of them are full of gluten, some of them have sucrose in them, some of them have other chemicals in them. There was a scare a while back where they were binding up and gelling in the intestinal tract, causing requirement for surgery. So that there are issues with those things, but they do work. That dogs are meant to chew. That's what they do. That's why if you get a puppy, they find their newest, most expensive pair of shoes and have them for lunch. So. I'm not using the chew in the eating sense. I'm using the chew when they open and close. You'll sit there and see the dog munch on in their open and close. It's a little different context, but that's a good point. She brought up that I used the word chew, and I was saying earlier dogs don't chew. I'm not speaking of chewing while like we do when we're eating. The dogs will gnaw. That's probably a better word. They'll gnaw on that chew stick as they're opening and closing, and that will help debride this biofilm. Yes.
What's your opinion on bully sticks, pig ears, antler bones?
Again, then you're looking at how much bacteria is on those, and if you're going to a wholesale cheap place and buying junk, that's what you're getting. There is a quality range of those where they're sourced and so forth. There's a choking factor with those as well. Some dogs want to swallow the whole bully stick, So, they would be effective in debridement, I will say that. I would never leave my animal unattended with something like that. Even a carrot, I would never leave them unattended. When you have someone that's coming into your place and want to sell you a product, you want to provide. Anybody can go to a big box store or Walmart and buy some stuff to clean the dog's teeth. You're providing a service, knowledge, education at the same time. So I would want quality products in my store. So if I sell fluoride, grain alcohol, or polysorbate 80, or sodium bicarbonate, or xylitol, which I see in animal products, and how many here know that xylitol is toxic to dogs? Yet I will see these in animal products, mouthwashes at the vet.